And with that, please note, on time, I'm going to hand off to Tessa, who actually was the co-chairperson with me of this Improving Coverage Measurement Working Group, as well as her day job as the Director of Statistics and Monitoring for UNICEF. So, Tessa, thank you for all your inputs.
Well, thank you, Jennifer. And thank all of you for your interest and support in this research and in the launch of this important series of methodological articles. I'm personally really delighted to be here, and frankly, I'm thrilled to see a room full of people showing so much interest and so much support for something that in the halls of UNICEF is considered to be a little bit of a dry research topic. But the value attached to these household surveys is frankly critical, and your support is absolutely critical. Why? And I wanted to just start my concluding remarks by just recalling that the world has really experienced enormous progress in reducing child mortality. The under 5 mortality rate has declined by more than 40% over the last 2 decades. But still, every day, 19,000 kids are dying. And similarly with maternal mortality, too many women are dying, millions of women are experiencing lifelong disabilities. So clearly this is unacceptable. Everyone in this room knows it. Everyone in this room is working towards it. But we have to make sure that these services are getting to all subgroups of the population to not only save their lives, but advance their well-being. National governments need data to assist in ensuring that. And as the United Nations Children's Fund, we are the voice for children. We advocate on their behalf. And in order for us to be able to do that well, we need the highest quality data and the most rigorous analyses that will stand up to international scrutiny. And I think as we've heard throughout the sessions this morning, and indisputably, household surveys are the cornerstone for this kind of information. And this is precisely why UNICEF has invested so much in the mixed survey program, and USAID supporting the DHS for, it's close to 30 years now, Fred, right? So together, these 2 household survey programs have provided most of the data that constitute our collective understanding of where we are in bringing these critical interventions to the most needed in the world. And I would say that this is a truly magnificent contribution to the advancement of the human condition. So UNICEF, of course, strives to continuously improve its methods and to remain on the cutting edge of data collection and analysis, and this work involves partnering with the best available science. And the work of the Child Health Epidemiology Reference Group has been absolutely pivotal. It has brought to bear the world's foremost technical experts in improving the measurement of intervention coverage. And as we have heard all morning, this is not an easy task. Incorporating these advances into the next cycle of surveys is essential. These surveys are going to be providing the data for our ability to monitor progress towards a promise renewed, which is the revitalized commitment for child survival and the countdown to 2015. And the next round of mix and DHS surveys, as I've already mentioned this morning, will be providing the data for the final assessment of the MDGs. Of course, that's been the centerpiece of the International Development Agenda. At the same time, this set of surveys will be providing the baseline for the post-2015 agenda. Now, UNICEF works with many different partners in various interagency platforms to ensure that we speak with one voice. Global monitoring requires standardized data collection and harmonized analyses. And indeed, we're living in exciting times for data collection with the rapid proliferation of new technologies to capture information in real time. We live in a world where nearly 6 billion cell phones are in use, including in the most remote parts of the developing world. And these new technologies show great promise in exponentially expanding the amount and range of data that can be acquired. But in our enthusiasm for exploring the potential of these new information technologies, I think it's important to recognize that different data collection strategies serve different functions. And while real-time information sources are attractive, they cannot replace household surveys. Household surveys remain the most important source of unbiased, statistically sound, and internationally comparable data. Survey programs like the MIX and DHS must continue to be well-resourced. They're absolutely vital to providing the data required to save and improve children's and women's lives. And in these days of declining resources, we must prioritize these survey programs in recognition of their critical function. And as we've heard from the speakers this morning, the complexities of measurement are profound. And the contribution of the methodological work embodied in the PLOS Med collection is invaluable, and we greatly appreciate the funding provided by the Bill and Melinda Gates Foundation that has made this work possible. Going forward, we must continue to pursue excellence in the way we measure the extent to which life-saving programs are reaching those most in need. We must also ensure that the resulting data are used effectively by those in positions of influence so as to ultimately improve the lives of children and women around the world. Thank you very much. But before I close this session, I would like to just take a moment to acknowledge the important contribution of Jennifer Bryce, who is really the driving force behind coordinating this very, very important effort. So a round of applause for Jennifer. So with this, as I understand it, I am the one to close this meeting. And again, I thank you for your attention and your interest and your contributions. Thank you.